Welcome to More Than Miles, the podcast created to look deep into what it means to be a runner and endurance athlete. Our episodes are filled with real stories from real runners, elite to the everyday athlete. We bring together healthcare providers, athletes, and dive deep into topics that matter most to runners. I'm Dr. Kate Mihevik-Edwards, physical therapist, author, athlete, and complete coffee addict.
And I'm Dr. Kacy Sinders, physical therapist, athlete, and pun expert extraordinaire. We are so passionate about changing running culture to improve the health, wellness, and fulfillment of our endurance athlete community. And we hope that these conversations inspire you to focus on putting your health first so that performance and PRs can follow. Now let's get to the show.
Hi, everybody. Welcome to More Than Miles. Today's guest is Dr. Sara Raiser. She's a sports medicine physician and a running medicine specialist in Atlanta, Georgia. Dr. Raiser works closely with several high school and collegiate teams. She is the co-director of the running medicine program at Emory Sports Medicine and an assistant professor at Emory University. She's also a member of the MAP team that both Kacy and I are part of for the Atlanta Track Club Elite.
You guys, this one is so good. We always cover a lot of ground in these conversations, but I feel like this one is, it's great. It has great medical advice, practical advice, just a really good conversation around running medicine in general. And we get to find out if Dr. Raiser was Surgeon General of running, what would she suggest that everyone do? So definitely listen in, and I hope that you enjoy this conversation with Dr. Sara Raiser.
Hi, Sara. How are you?
Hi, Kate. Hi, Kacy. Thanks for having me.
Yeah, we're glad to have you here today.
Yeah, thanks for being here. I know there's so many conversations I think the three of us have had, or maybe the two of us have had, where they would have been really valuable podcast conversations to have recorded. So I'm really excited that this one is on the record.
Sounds good. I remember a few of them happening in the middle of clinic too, where we're both running around. So
yeah, we each have patients in the room and we're calling each other.
That's right.
That's the best. That's one of the things I love about our relationship is that we can do that and we can text each other and just really kind of work as a team for our patients.
Totally agree. I think it's a piece that's missing in a lot of modern medicine, unfortunately.
Ooh, I wasn't going to go down that path, but yes.
Well, we've just made our own team. We made it happen.
That's right. We've picked all our favorites and now we're on a team together to work together, which is great.
Yes, definitely. A lot of what I do working on multidisciplinary teams is a big piece of that. And I love it because I get bits and pieces of expert knowledge from all these other folks with different backgrounds.
Oh my God, isn't that the best? I feel like the last several years I've learned the most in my career just because of the people I work with.
Absolutely.
Well, let's jump right in. You ready?
Let's do it.
The first question that we always ask everybody that comes on our podcast is, what is your athletic or running background? So tell us a little bit about how you got into running and some of your background.
Yeah, so I actually grew up riding horses. My sister initially started riding them, and I think I've got pictures of when I was like 4 toddling around and riding on the ponies. And so I initially started out riding, and then I wanted to run when I went into high school. I don't even know how I found out cross country existed, but I thought you had to do tryouts. And so I started practicing months before. And actually, now that I think about it, the way that I decided I really enjoyed long distance running was I went with my sister to Stone Mountain Park and we did a 5-mile loop. And I thought, well, when I got tired, I would walk. And my sisters, once we got to that point, I was like, okay, I can't go anymore. She's like, no, we're not stopping. We're going to continue. So we ran 5 miles and I was so sore. I couldn't believe it. And I wanted to do it again. That's when I'd always enjoyed sprinting and, I had enjoyed some of the kiddie track and field things when I was in elementary and middle school. But I thought it was so empowering that I could run that distance. And that was so cool. So ended up finding out about cross country and ran in high school. Absolutely loved it. Wanted to run in college. And when I went to Emory for undergraduate, I walked onto the team and ran a season. But unfortunately, I'd had a good number of injuries up to that point, and I'd kind of made a deal with myself. If I have another injury, I'm not going to run anymore. And what do you know? I had another one. So I ended up they had a club triathlon team, and that's when collegiate triathlon circuit started around that time. And so I got to go to one of the first nationals for collegiate triathlon, which was super fun. Ended up getting involved in the club sports arena and had fun with that the rest of my time at Emory. Ultimately transitioned to doing other things. I did some half marathons and CrossFit and a few different things during my training. And I'm starting to get back into running a little bit more these days. So I've had a little bit of a respite from regular running. I definitely got to the stage of I'm just going to do whatever feels good. So if I wanted to lift, I'd go lift. If I wanted to run, I'd go run. But I definitely got a little bit burned out towards the end of my collegiate time. Told myself I could do whatever felt good, which I thought was actually very helpful to reset. Took a lot longer to reset than I thought it would, but starting to get the itch again.
I think that was really smart. So many people get burnt out in collegiate running and even before that, and they just keep pushing themselves to the brink all the time.
And I take care of runners every day, and I love it. I feel like it's very fulfilling, even if I'm not doing regular running every single day. I remember what it was like. It was running in high school was a life-changing experience and a huge piece of identity for me at the time. So I definitely know how much that can impact folks. And I'm not a pro runner, but imagine what it might be like to be a professional runner and treating those folks. I think it helps me understand the shoes they may be in at that time.
All three of us have such a passion for the sport. And so being on the other side is almost as good as being like actually an athlete. Cause I think all of us like just the idea and lifestyle of being an athlete. So I've experienced that too, just taking care of people at different levels of ability and skill. I think is really fun. So it lets me feel like I'm like semi-professional too.
Well, and I have recreational runners who come into the clinic and are surprised that I want to do run gait evaluation on and spend lots of time with them. And they're like, but I'm just recreational. I'm like, no, this is a really important thing. It's identity for people. It's stress relief. It's ways to socialize. Like there are a lot of components that running can serve or purposes that running can serve in people's lives.
Absolutely.
Yeah. So let's talk a little bit about your professional journey. So when did you decide that you wanted to be a physician and then eventually getting into running medicine specifically?
So when I was in high school, I knew what I wanted to do, but I couldn't articulate it. I didn't know what it would take to get where I wanted to go. I had tried to find running medicine doctors when I was in high school and really was not successful. There are lots of things. Boy, I wish I had known when I was in high school. Would have been so cool to have a run gait evaluation or meet a sports dietitian. I had no idea those things even existed and could have had a different collegiate career had that been the case. So when I was in high school, I met a massage therapist who I worked with a good bit and started to realize that I could start catching some things a little bit early. So if my muscles or joints started to feel kind of off, if I visited with her, it took a little bit of relative rest. Imagine that. I felt like I could start kind of nipping things in the bud. And of course, that's not the only answer to things that are going on, injuries that are happening with distance runners in high school. But I became fascinated with the idea that you could manipulate those things. And if you became more in tune with your body, you could catch things earlier. So for undergrad, I knew I wanted to go into medicine. So medicine meant going to medical school. In my book, I didn't know a whole lot about other types of medical positions, such as physical therapy, occupational therapy, sports dietitian. Didn't really have exposure to that. So if you want to go to medicine, you went to medical school. So I did my degree in biology at Emory and kept thinking, man, when am I going to get to like the big stuff? Like we're going to talk about the muscles and biomechanics and stuff. And I was like, what's with all this cellular stuff? So I very much enjoyed things like anatomy and the big picture things. So when I finished my undergraduate career, I took a gap year, planned to apply to medical school. But then during that gap year, I went to massage school, which I think gave me a huge appreciation for musculoskeletal system and care, and gave me the ability to understand touch and that sort of those sort of concepts that really aren't explained or harped on in medical school. So even my anatomy courses early on, or even our physical exam courses early on, I felt like I had a little bit of a leg up in those areas simply from having the massage therapy education. I'll admit it did not come naturally when I was first there. And I had days that I started to practice thinking I made a big mistake. But then it came to me and I had a great time. I work with my husband all the time, so he's appreciative of my skills. I do still have my licensure. So
wait, hold on. You actually work on your husband? Oh, you're such a nice wife. I do not work on my husband. I love him very much, but I cannot work on my husband.
He would like more regular care, but I do. So finished that, went to medical school. Interestingly, I ended up going to University of Florida. I applied regionally, and that ended up being the place I liked the best. I'm in my first summer between first and second year, and I am doing a research project in a human performance lab. Well, it turns out the human performance lab is associated with the running medicine clinic. So I stumble across Dr. Kevin Vincent and say, hey, I want your job. What do I need to do? He said, well, you got to go to University of Virginia. You got to train with Dr. Robert Wilder. And I said, okay. So went there, did my physical medicine and rehab residency. So initially got to train with Dr. Vincent and then trained with Dr. Wilder, who had a treadmill in his office, saw lots of runners every single day, got folks on the treadmill while we're sitting there, had specific people in the community that he sent his folks to that he knew very well, did some run gait retraining. And then I was fortunate enough to work with Dr. Michael Frederickson out in California at Stanford, who is also a running medicine expert. Spent my time doing fellowship there for sports medicine. So I was very lucky to be able to make 3 stops with running medicine experts and learning different tidbits at each stop. I enjoy all the different pieces or different aspects of running medicine. So that's from doing the big stuff like dealing with female athlete triad or REDS, relative energy deficiency in sport, talking about iron deficiency, talking about vitamin D deficiency, nutrition, psychology, and then run gait evaluations, the musculoskeletal care. And then, of course, bringing a little bit of my background to the table as well to help with that understanding. So in high school, I could have told you something like that, but I didn't really know what it looked like. And I certainly don't regret any step in my path. I'm very happy with the different things that I've been able to do up till now.
Well, one of the things that we were interested was talking about some of your mentors and talking about some of the people that you've crossed paths with, because you have been really not lucky. I know it was planned, but you've really been in the presence of a lot of really incredible running medicine docs. And out of those people, like, what were some of the tidbits that you learned? You mentioned that you took some tidbits away from each of those mentors. Can you tell us a little bit about your experience with them?
Yeah. So starting with Dr. Kevin Vincent, one of the things I feel like I learned first with him was running medicine is kind of its own entity. Like I alluded to earlier, running can serve a lot of different purposes in people's lives. So it can be their stress reliever. It can be their hobby, their competition. They can be on a team that they compete with. They can be professional. And so learning those different roles and how different running can be from other sports, and that there's a lot of things you need to think about. You're dealing with chronic overuse injuries as opposed to acute injuries. And interestingly, you can have something that looks exactly the same, but if it's acute versus chronic, you treat it very differently. So got a little bit of that with him. They also did it. They have a human performance lab. His wife, Dr. Heather Vincent, also works out of there, and she's an amazing scientist. I got to work in her human performance lab a little bit, or really I got to shadow and watch what was going on. But they did some amazing things there, and I got to see them do VO2 max testing. They used a force plate treadmill, so a variety of different things they did in terms of evaluating runners, and then also looking at exercise as a whole, general population. Dr. Wilder, one of the biggest things he added was the run gait piece. So I got to see a lot of real-time run gait. Dr. Vincent's lab did that as well, but I felt like we got to break it down with, here's an injury. Let's get you on the treadmill when it's safe to do so. And is there something that stands out that's going on? He does real time. And so he's not necessarily doing video, but it was really cool to have folks in the office. And of course, that helps a lot when you're a runner and you go in and you have a problem and someone says, well, let's watch you run. It makes a lot of sense. So it was a lot of fun to work with him. Dr. Wilder, a lot of the things that I do in my clinic very much are geared after his training in terms of how I write my notes and trying to make things very simple. So writing out very specific instructions and saying, hey, this is where you go to get this particular brace or wrap, or these are the physical therapists that you need to go see at Precision to get your run gait evaluation, do your retraining. So trying to be very specific and offering all those different pieces. Dr. Frederickson, I got a lot more in terms of low energy availability and kind of more holistic care. And then also got to work with a lot of collegiate teams. So the Stanford teams, we worked with their athletes a whole lot. And so I got to see that side of things, as well as some of the pro runners that he had come through clinic too. So definitely that was kind of the last piece to add, which worked out perfectly. And then, of course, a good bit of research that he was doing as well. So I've still got connections with all three of them. Dr. Adam 1040, who trained at Stanford as well, who's now up at Boston. I've also worked with him a good bit as well. And he's got some very cool tidbits. He actually ran collegiately out of Stanford as well. So he's another great connection that I've had through this process.
I remember reading his papers.
He's doing some really cool stuff. So also the shockwave therapy piece is also new, and he's taken that bull by the horns is using it for all kinds of things these days. So doing a lot of the research right now.
Yeah. Wow. I mean, what a group of mentors. We think about running medicine as its own entity, and it's not that common, right? So it's like not like every medical facility has a running medicine department. You happen to get to make stops at pretty much all of the top ones, or maybe even most of the only ones that exist, which is just pretty amazing. I actually had brief conversations with the Vincents as well, because I went to University of Florida for undergrad, and I had an internship my final year where I actually attended the running medicine conference there that I think they still have, or they may not be holding it anymore. But I remember sitting in that room and just being like, whoa, like this is what I want to do. So cool. Also, this is going way back, but most people are like, I'm going to take a gap year and travel Europe or whatever.
Oh, yeah, I agree. I wanted to circle back.
I'm going to just take on this career just for fun.
I'm going to take a gap year to have another career or another set of skills.
Yeah.
Yeah, no, it was fun. It was a 6-month program. I had a blast. I mean, if you're going to go do a very different education than what I was doing at Emory. So it felt like a break. Got to meet a whole different set of people, and even worked briefly as massage therapist for the last few months before I headed off to med school. So it was fun. And I say I got a little bit of real world experience too. So I worked as a sales associate. I feel like I did some kind of teenager, young adult things. And honestly, I think it's worthwhile to do. Have a little time that you're not in school, because I've spent, unfortunately, a very long time in school and in training.
So on that topic, what if there was someone listening to this podcast that wanted to go into running medicine someday? What would you say? Because like you said, it's a very long career and there aren't many of us out there. What would you say to them? Like, what kind of advice would you give them, and what would you tell them to do?
A really great question. Obviously, if you have a local running medicine doc or physical therapist who are running centric, getting in with them and having conversations with them, seeing patients with them, and getting involved in the community and the folks they are connected with. I think that getting involved in the different aspects of it is important too. So even talking to sports dietitians who might treat runners, talking with someone who makes orthotics, folks at running shoe stores. So just kind of getting to know the running community, I think, can be really great. I think that we still have a ways to go in terms of kind of putting together a national group per se. Kate, wink, wink. In terms of knowing,
don't you sign me up for another thing, Sarah?
In terms of who does running medicine across the board, because you treat injuries differently, and you need that additional expertise, especially for folks who are having recurrent injuries and we can't kind of figure out what's going on. I was having a conversation earlier today about a gentleman with a stress fracture, and I was like, look, if you just rest this thing, but then you go back out into the same environment that you developed the stress fracture in, well, you're probably going to have the same injury that comes back up. So we've got to figure out how we change that environment. And it's like a problem solving game. I think it's fun in a lot of ways. And it's also really fun to be able to crack the code and keep people running and not having to come back for more downtime, more injuries. So, I definitely think getting a wide range of shadowing experiences is really important, and getting to your community. I think running, especially because it can be so recreationally based and community based, I think it's really important to know who are your resources in the community.
And you bring up one more thing that is really interesting, and I think a lot of people don't necessarily realize when they want to go down this path. I know Kacy knows it very well. I know you know it very well, and I know it very well. But running medicine is not an in the clinic kind of job. It is a out in the community, be involved sometimes at night at running stores, sometimes on the weekend at running events kind of job. We all were working the Peachtree, which was like a week-long 24-hour race almost for us. But that's something that I would also maybe like you to speak to, because even though I kind of knew that, I didn't really truly grasp it until I was deep into it. The idea that running medicine is much more than a job that you go to.
Yeah. And for some folks, they don't want to necessarily cross those lines. They'd rather have running be the thing they do in their free time. Whereas, now when I'm at a race, I'm working, but it's something I love. For me personally, it's okay. There are other things like horseback riding. I don't want to work horseback riding events. I go and have fun and I watch. And I've got friends that I spend time with. And so that's purely recreational for me. But for running, yeah, it's work, but it's something I really enjoy and am passionate about, and something that will help me maintain a very long career. But yes, they're nights and weekends. And when you're taking care of runners and say they have your phone number or email and they've got emergencies coming up and they got a race coming up, well, they may be reaching out to you. And for me, my perspective is I remember being in their shoes and I didn't have anyone to reach out to, and I'd love to be able to help people that way. So I really enjoy being able to be there and help provide some answers. And when I can't find the answers, I find someone who can help. So I was even talking yesterday to one of your therapists who is collaborating with another therapist about a patient we've been trying to take care of. And it's just so cool to be able to have all these collaborative conversations about what might be going on and what needs to happen next. And I think patients appreciate that. I certainly would if I were in their shoes, because it's nice to have more than one head thinking about things can be really helpful.
Yeah, it's so much easier for me to sell someone to go and see a physician, or say, hey, I'm usually talking about you. I talk to her all the time. We text all the time. I'll give her a heads up that you're coming, what's going on. Like, I just feel so much more comfortable going in that case than if I'm just like, okay, here's a number, make an appointment. I feel like if this is something that we need more of this, right? Like, I love our situation, but I know that this isn't common for most people. And for most, PT and physician kind of relationships. So it is really special, and I'm grateful for it.
Absolutely. I think it's very valuable. And I do the same thing. I'm like, well, I'm going to be talking to them about 2 hours on a meeting. So I'll mention it to them. Or I've had times that I've called Kacy in the middle of clinic. I'm like, can you talk to me for just a minute? So I'll go back in the room and say, hey, just chatted with Kacy. This is what we think. So I agree. It's a big deal. And I think it can be hard for communication. I don't find that communication between us hard. But it does take extra effort and extra time. But I think that is very valuable.
Yeah. And we've talked a little bit about this already, but I want to take some space and time to talk about this whole, like, a team approach that we've had. And of course we can think about this, in the way that we formed a team to work with Atlanta Track Club Elite, but just how amazing it is where, okay, we have a runner who's injured, right? And it's like, okay, they're injured. Like, let's have them see you, right? And you say, okay, this is what I think is going on. Go to PT. And then I say, okay, this is what's going on biomechanically. And then we can talk about, okay, I think there's a nutritional component to it. And we can all just kind of talk about it and solve the problem together. Because as we know, no injury is ever just biomechanics, right? Like, no matter what sport we're talking about. And I think we're obviously talking about running medicine here, which we know, like, ins and outs and the tiniest of details. But the reality is like, humans are so complicated and there's so much going on. And so the fact that we can bring together people and talk about the different aspects and, like, have all of our knowledge, like, overlap, I think is so cool. So I'd be interested to hear kind of your side of working with a team and like, what kind of information is helpful for you to have when we're all talking.
Yeah. So the way I explain it to athletes is it's a perfect storm, and we're never going to be able to put our finger on exactly what happened. There's probably a biomechanical component. There's probably a training component, and probably nutrition. And we need to look at all of those things and figure out how we optimize it. And if there were holes in any of those areas that we need to address. So from my perspective, someone who's injured should be seeing all of those people. You should be seeing a physician, a physical therapist, a sports dietitian, and then psychology, because there's a brain that's running the show too. So that's really important too. And psychology is not necessarily managing a mental health condition or some other pathology, but it can also be about managing your identity or feeling more anxious when you can't run, which may have been your stress reliever. or you're anxious about what's going to happen when you're coming back from your injury. So all those different pieces I think are really important. When I have a patient in the office, I don't have as much time as I would like to have. I was talking about our Emory running symposium that we had, several weeks ago. Time just flies. And ultimately, the folks that we had speak at the symposium were folks that I've referred directly to. And this is my multidisciplinary team, which was so awesome to see. But you might notice it took us 4 or 5 hours to go through all of that. And that's kind of how I feel as if every patient, I just need them to sit down and, listen to this 4 to 5 hours. But I don't have that much time with a patient when they're in my office.
So link, you can watch it on your own time.
I know. They're like, hey guys, not that I'm plugging it, but that's what Fast Bananas is for. It has it actually has probably 40 hours of information for runners need to know.
And they're like, can I have the Cliff Notes version of this?
I know, but there are Cliff Notes. But that's right. So, no, that's exactly right, Sarah.
Yeah. So basically figuring out what are the, biggest priorities that we need to deal with, getting labs, imaging, bone density scans as appropriate, and then getting folks out to my partners in crime, like you guys, that can help go through those things as well. Because not only will they be able to go through things with a whole nother appointment in time, but they'll also do them with someone who's an expert. And that is a primary thing that they do, while also having that background in running medicine and better understanding for runners. So I'd love to set up 5-hour appointments with my patients, but I just can't. I can't see enough people in a day for that. So having you guys in the community works very well. Plus, I learn a whole lot from everyone too. So it's nice to hear different perspectives and even hearing like specific applications, like when our sports dietitian can go through exactly how she would go about things. These are the things that we would add. These are the types of foods I would add. I told the athlete to do a smoothie in the morning because liquid sits better with hers, something like that. So having those really concrete additions, I think, can be really helpful. And it's helpful for my education and being able to help patients too.
I love to hear our sports dietitian speak too, because I learn something every time she speaks. Just like you said, I'm like, wow, I didn't really realize you could use food that way. It's almost mind blowing every single time. And it's been, a long time, and we listen to her every week.
I know. I'm pretty sure I'm the one that's typing nutrition is the best ever, like in the chat every time. Like, I know. Dietitians rock. Nutrition is the foundation.
And then with the sports psychologist too. So one of the sports psychologists we work with and always says that mental health is a continuum. So you're not on one end or the other. You're somewhere in between, and it moves back and forth depending on what you're going through in your life. And so that's one thing that takes a long time for me to convince my patients to take care of and to go and see somebody. But eventually, if they really need to, they end up going. How do you have that conversation with your patients? Because I usually just say, like, I love therapy. I've been there. It's helped me a lot. I know this can be helpful for you, and it's not always because something's wrong. It can be very supportive, but how do you do that?
Yeah. So some of the things that I mentioned before and just talking about, hey, this can help get you through in terms of your mind space and being able to manage being off of running for a period of time, or wrapping your head around dealing with an injury, or how do you get back into that training again? Finding support through those processes, or someone who feels like they're losing their identity because we've got to modify something. Say they've got arthritis that we need to take out some of the running. And so finding ways to manage those sorts of things are pretty direct conversations. I think when I have folks that I'm feeling a lot more resistance in terms of them being willing to go see someone, even from a sports dietitian standpoint, I have folks who are very resistant to seeing a dietitian and trying to kind of meet them where they are. It might be that I try to meet with them a little bit more often than usual. For most chronic injuries, I'm seeing patients back every 2 to 3 weeks, because I always tell them, hey, if things are progressing faster, great. I want to see you back so we can actually start progressing more, because I want to get you moving as soon as we can. But that also gives me an opportunity to talk to folks about their headspace. How are they doing mentally? How's their nutrition going? Have they had time to process some of these things and say, well, maybe I'm actually not getting enough nutrition. And more I think about it, maybe these are some things we could do. Or I was thinking, hey, maybe I'm not, so giving them some time to process in between each of our visits, I think is really helpful. And a lot of times, I may give them a little bit of information like, hey, here's a couple dietitians you may see, or sports psychologist if you feel like you need to reach out to folks. So I'll give them a whole list of resources when they come in with a chronic injury or overuse injury, but I may not necessarily spend a lot of time directly addressing that until I feel like we've developed a little bit more rapport and they've had time to process. Because usually once I say you have stress fracture and I mention no running, they're shut off. So giving us some time to manage with that. And I get that. I mean, I've spent my share of orthopedic office visits crying, and I don't remember anything else that was said after I heard stress fracture. Folks need a little bit of time, and I think a lot more touch points can be very helpful, which is where having a multidisciplinary team is really helpful, because then when they come and see Kate and Kacy, then they can also address those things, and maybe they've had some time to mull it over and say, actually, I think I do want to see a psychologist. What do you think? So I love that piece, and I love getting on the phone with you guys and you're like, hey, we had a conversation about potentially seeing a sports dietitian, and these are some things they brought up. Do you think we should get their vitamin D checked? So I think those things are really important too. And you guys get to spend a little bit more time with your patients typically. And so more things may come about. And so that's really helpful from my perspective as well. So I would say I think there's a lot of trust and rapport building to be able to have those conversations, which I know Kate and Kacy, when you have hour-long visits, I think that comes a little bit quicker, which I think is really nice to have you guys as collaborating partners, again, for that reason too.
Me too, Sarah. I love it.
Yeah, I really think as healthcare providers, a lot of our job is just helping people frame what's going on and like helping form their perspective. Obviously they have to come to that conclusion on their own, but I think how we talk to them, I think is more important than anything that we could really do intervention wise. And that's why I think makes our team great. I'm just going to keep praising us. We're amazing.
It's all right. Keep going, Kacy. Sometimes we need it, right?
Yeah. I mean, on the note of therapy, I cannot imagine going through my life without a therapist now, let alone if something major were to happen in my life. So big plug for therapy, no matter where you are.
Well, my argument for therapy is, why do you need to go? Life?
I mean, that's all of these things though, right? So if you look at, like nutrition and mental health and strength training, like all these things, maybe you're not a professional athlete. So why are you spending so much time and money on this? Well, no, this is for you overall as a healthy human being navigating the world and like being as fulfilled in life as you want to be, right? Like this isn't just for running. All these things are going to benefit you anyway, right?
Keeping your body healthy for long term, staying functional later into life. I mean, those are some of the conversations I have with some of the older runners too. And we have a conversation about, you got some arthritis in your knee. I'm not going to tell you stop running, but we're going to talk about some risks and benefits and how maybe we can kind of modify the stress that you're putting through that knee. But if you want to run, let's talk about how we can make it the safest for you. I think it's so important to talk about the function piece of it and keeping people healthy long term. A lot of the dietitian or the nutrition piece of things, there's a lot to be said for our health down the road of how we fuel our bodies. Not necessarily to go down this road, but if we talk about our adolescent females going through puberty and having low energy availability issues and losing their periods and dealing with those types of issues, I mean, can have some pretty serious consequences by not getting nutrition that you need during a critical developmental stage in life. And I think that is not underscored quite as much as it really should be.
Well, you continually lead us really well into our next question. And the thing that we actually wanted to talk about next was a little bit about RED-S, what it is, and can you explain the impacts and injury risk and injury recovery around RED-S?
Yeah. So I recently went to the Female Athlete Conference in Boston.
You were there? You were there? I didn't realize that. We were all jealous. We have the online version.
We're going next year.
Every other year.
We're all going. We're going to go on a field trip.
Yep. Kelsey wants to go too. So let's do it.
Okay, good.
It was amazing. Number one, they did a updated consensus statement and they're changing it to REDS, not RED-S. And REDS is relative energy deficiency in sport. You may have heard of the female or male athlete triad, which is we've got kind of two competing boats, but ultimately we're talking about the same thing. We're talking about low energy availability. So does your body have enough nutrition to be able to feed all of the different body systems that need that energy? If you're not getting enough energy to feed all those needs, and say you went for your 10-mile run in the morning, but then you're not eating enough nutrition throughout the day to support those processes, well, you can't just take back that 10-mile run and get that energy back. You've got to take it away from metabolism somewhere else in your body. One of the places that commonly happens is your reproductive system. So we have a lot of female athletes who are doing a lot of activity who will lose their period and say, yeah, that means I'm training really hard. This is great. Well, actually, it's not good, because it means that your hormone levels aren't where they need to be. You're starting to pull energy from different systems. You might be leaching important nutrients from your bones to help support your other body systems. So we end up having a lot of issues that can result from low energy availability. So not enough nutrition or energy in to be able to support all of your body functions and the activities that you're doing. This can end up affecting all the different body systems. So we classically think about your bone health, so getting low bone density as a result of it, which can lead to stress fractures, losing your period for women, or potentially having low testosterone symptoms for men. But ultimately, we know that it can also cause things like fatigue. It can cause hair loss, dry skin. I mean, all these different things that require energy and nutrients. It can affect your concentration, irritability, your ability to, have good relationships with other people and concentrate in class. So it's actually a pretty big deal. So folks who are losing their period or having low testosterone symptoms or simply feeling fatigued, those are good reasons to go in and see someone like myself, a running medicine doctor, to kind of screen for what could be going on and what do we need to address. There are a lot of different ways to manage it. Sometimes it's simply load management, doing too much training and not enough recovery. But there can be other things that we may address from that standpoint. Sometimes we're doing some supplementation, but ultimately that's not what I want to do long term. That's to quickly kind of get you up to speed. But then we're also addressing the nutrition component, the training component. And then oftentimes the sports psychology component is important too, because part of the question is, well, why are we doing so much exercise and not getting enough nutrition? Is it just that, hey, I forgot to eat and just didn't think about it? Or is there something else that's underlying all of that? We classically may think about eating disorders being related to REDS, and it can be, but it doesn't have to be a severe diagnosed eating disorder. It can also be what we call disordered eating. So different patterns of eating that aren't sufficient in terms of giving sufficient nutrition to support your activities. It can even be that if you do all your nutrition at the very end of the day, but you're super active early in the morning, well, your energy balance isn't where it needs to be. You're burning the gas before you put the gas in the tank. So we need to think about, making sure that your energy balance is staying up to par all throughout the day. And especially our really high volume athletes are going to be much more apt to have these deficiencies in energy.
Yeah, so it's what I'm hearing is it's a lot more complicated than calories in, calories out.
Very true.
Sara, can you speak a little bit to during injury recovery, right? So I think a lot of people, when they get injured, they alter their nutritional intake because they're like, well, I'm not exercising. I don't need as much. Can you talk a little bit about how that could impact ultimately timeline of the recovery and things like that?
Yes. And I think Kacy Pontius does a wonderful podcast where she talks about these things. So she's a sports dietitian who works on our professional athlete team. What's that?
Shout out to Kacy.
I know. I think about it all the time because she did such a good job in really emphasizing all the areas where if you're not getting enough nutrition during your recovery, not only might you delay your recovery, but we may not get the recovery that we need. And so, she talks about, your metabolism actually increases when you're trying to heal an injury. You've got to be able to feed the energy and all the nutrients that you need. Where do you think all those new components of bone are coming from if you're not actually feeding yourself the calcium, magnesium, phosphorus? So you've got to make sure that you're getting that nutrition in and then also supplying your body, your metabolism with that energy to be able to do that healing. One of my favorites, Kate, she likes to talk about stress is stress. So when we talk about psychological stress being a big component that eats up energy and stresses the body too. So if you're really stressed out while you're trying to recover from an injury, well, that's going to impact your recovery too. And so that's part of the piece of the sports psychologist in terms of helping to provide you with tools to manage your headspace during that time as well.
I have one more question that I'm very excited about. Are you ready, Sara?
Is it the last one?
No, it's not the very last one.
Oh.
So this position doesn't exist, but I'm going to make it up. Let's say that
I loved this question. I'm sorry.
Let's say hypothetically that there's a Surgeon General of running. Okay. And so let's say that you tomorrow are given this position of Surgeon General of running. So what universal recommendations would you make for us as a community if you were in charge?
Well, that sounds like the best job ever.
I agree. I agree. I think it'd be an incredible job.
So I think one of the most important principles is moderation and doing things with a slow progression. So anything that you do, you're not making big changes because, one of the things that I'm looking for when someone's got an injury is I'm trying to figure out, well, what changed and did it change too fast for the body to accommodate? So that's changing your shoes too fast, changing your volume, frequency, intensity of training too quickly, not taking a day off every week, thinking about all of those things, and then the gradual progression when you are increasing them, only increasing one thing at a time when we're talking about training, like just frequency, just intensity. So that would be kind of the biggest thing that I talk about. And in some ways, I think you can talk about that with nutrition too. So having some level of moderation, always having some nutrition that you're getting throughout the day, making sure you're hydrating throughout the day. So I think that's probably one of the most encompassing things. Dr. Wilder, actually, one of the things that he would always tell folks is if your pain is more than a 3 out of 10 when you're running, or you're limping or changing your gait, or you have pain that lasts more than 24 hours after your run, those are reasons you should not be running. So something's got to do low impact activity or something else, and it doesn't cause any of those symptoms, then that's fine. But any of those things that are coming up, those are reasons you should not be running. And I've used that, ever since my residency in terms of being able to figure out, should you be running or should you not? I also tell people with regards to visiting a physician, if you've had a couple days off, so you have pain, you take 2 days off, pain hasn't changed, you try to run again, still exactly where it is, you need to go in and see someone. So go see a physician and figure out what's going on. If a day or two of rest resolves the pain, doesn't come back when you get back into your training regimen, then you could move on cautiously. But I think the moderation, progression, listening to your body, all those things are really important. Sometimes I have folks who come in who have pushed through that pain far too long. And I know you both deal with those as well. And if we had just caught a little bit earlier, the path might not be quite so long. Yeah. And if I was Surgeon General, we would have running medicine teams just in every city across the country. It would be very important.
Agreed.
So I certainly would like to see more running medicine specialists more available, because I think I've probably only got 4 or 5 cities that I know of specific folks at this point. I know they're more out there, but they are relatively far and few in between.
Well, all right, Sarah.
Yeah, me too. I'll vote you in any day of the week. All right. We only have time for one more question. And this one hopefully isn't too much of a doozy, but it's definitely for our audience. I hope they're still listening. So oftentimes we see runners that have waited a really long time to seek out medical care because or with injuries or pain. What would you say to a runner who's putting off making that appointment with a sports medicine doc or PT or whatever it is? What would you say to them?
One of the first things that comes to mind is simply that, hey, we may end up dealing with more injuries. Once you're compensating your gait or making an injury worse, it's going to take longer to get better. But ultimately, hey, do you want to run with pain? I'm like, no, we want to get things figured out. We want going through a run gait evaluation, run gait retraining, physical therapy, seeing a sports dietitian. Not only can you feel better, but you may actually run faster too. So, I always tell folks that too. I'm like, I've seen a number of folks in their senior year of high school who have an injury, and it can be seen as something catastrophic. They missed their senior year. Or you just got connected with a sports dietitian, a sports psychologist, a physical therapist who's able to go through all of these things with you. And you may actually be even better off in your collegiate career in your next step. So really reframing that piece of things too. But ultimately, we want to run pain free and for the longest time that we can. And, being a little faster doesn't hurt either. It can be fun.
Well, thank you so much, Sarah. This has been a lot of fun. And
thanks for having me. I forgot we were even recording.
I know this is how our normal conversations go. So it's really great. And I'm glad other people got to listen.
Yeah, nailed it.
Thank you so much for listening today. We are so happy that you're here. If you enjoyed this conversation, share it with a friend. Even better, share it on social media because sharing is caring. And the more people we can reach, the better.
Another way you can help us out is by leaving a review on Spotify or Apple Podcast. So give us those 5 stars and tell us how awesome we are. Really, we love to hear how awesome we are. To support our work financially, you can also join our Patreon squad at patreon.com/morethanmiles, where for a few dollars a month, you can help us keep the show going and growing.
This season is sponsored by Fast Bananas. Why buy multiple subscriptions made for everyone when you can have one specifically crafted for runners? Fast Bananas has online yoga classes, strength training programs, meditations, recipes, communities to ask questions, and so much more. Check out Fast Bananas at fastbananas.com or follow them on Instagram at fastbananasrun.
Don't forget that training is so much more than miles.